A woman battles pain and depression. She's taking a lot of medications. The patient discusses this with a rheumatologist. She also consults a pain specialist. She also talks to a psychologist. Research shows medical marijuana can help. She researches medical marijuana. It can reduce pain and depression symptoms. She tries medical marijuana. She needs less medication. Her symptoms improve. A journey of healing and self-discovery.
Hi there, that was a quick video about fibromyalgia and the potential benefits of medical cannabis. My name is Lynn McClure. I will be discussing about fibromyalgia, medical cannabis, and other alternative therapy for fibromyalgia. Let's take a look at fibromyalgia. It is a rheumatic condition that encompasses multiple symptoms. These include chronic diffuse generalized body pain that most describe as head-to-toe joint pain, muscle pain, aches, and soreness. Patients with fibromyalgia also describe brain fog, migraines, numbness and tingling, insomnia or sleep issues, as well as anxiety or depression. There has been a lot of research and critically reviewed literature that supports the appropriate use of medical cannabis, otherwise known as medical marijuana, for the symptoms management of fibromyalgia. Medical cannabis is a plant-based alternative therapy that has chemicals of cannabidiol, CBD, and tetrahydrocannabinol, THC, that work together as an effective compound to balance each individual's endocannabinoid system. This is a powerful herbal plant that is used in medicine. Evidence-based literature shows that appropriate use of medical cannabis with direct guidance from a medical marijuana physician specialist can improve symptoms of fibromyalgia. It has many effective benefits, including anti-inflammatory effects. It can help improve symptoms of joint pain and arthritis, muscle pain, nerve-related pain, sleep issues, migraines, and digestive issues. Medical cannabis can also reduce anxiety and depression. It does not have detrimental side effects compared to pain medications such as narcotics. This in turn can help patients with fibromyalgia decrease the use of multiple prescription medications that can cause dangerous side effects and/or drug-to-drug interactions.
We have a whole field of beautiful hemp plants, and these hemp plants create what is known as cannabinoids. There are over 100 cannabinoids that can be found within the cannabis plant. Cannabinoids can be found in other plants. They're found in cacao, so that's why when we eat dark chocolate, we feel great. But cannabis is definitely the plant that can produce the highest levels of cannabinoids. There are cannabinoids that I'm sure you are familiar with, such as THC, CBD, and some lesser known ones like CBG and CBN. These are all acronyms. THC stands for tetrahydrocannabinol, CBD for cannabidiol, but these are all compounds that are found within the plants, and our bodies actually interact with these compounds. Why are we having these reactions to them? It's all because of this system called the endocannabinoid system.
The endocannabinoid system, it's a homeostasis controlling system, basically is our physiology and how we keep ourselves in balance. We have a variety of endocannabinoid receptors, mostly CB1 and CB2, and they're located throughout the body. CB1 receptors are mostly in the central nervous system and parts of the brain. CB2 receptors are mostly in the peripheral part of the body, in the skeletal system, in the GI tract, and the spleen, and the testes, and the ovaries, and they control a number of other processes. We do make our own endocannabinoids that play a role in the things like mood and appetite and emotion and digestion and inflammation and immunity, but we could also tune up some of that homeostasis if we're lacking it by use of phytocannabinoids, phyto meaning plant. So we have plant-based cannabinoids, which we all know as marijuana.
Where do all the cannabinoids come from? CBG, or cannabigerol, CBGA in its form when it's in the plant as an acid, is what we know as the mother cannabinoids. All the cannabinoids come from CBG, and over time, the plant has a gene that converts those cannabinoids, the CBG, into both THC and CBD. In our process, we focus on using the buds, which most of the cannabinoids are within the flower of the plant, and we also use the leaves, but the sticks and stems aren't really useful for extracting cannabinoids. In order for us to extract CBD from the plants, we have to first dry the plants. We actually hand harvest every single plant, and then we hang dry them in our barns, and it takes about 10 days to 2 weeks for them to dry down, slowly cure those cannabinoids, because cannabinoids and terpenes are highly volatile, meaning when they're mixed up or there's heat applied to them, they will dissipate. In order to extract the cannabinoids, there are a lot of different ways of extraction depending on what the finished product is. We use what is called ethanol extraction. We basically start first with a wash. We load a bag of ground hemp into a centrifuge, and that's gonna rinse all the hemp leaves in ethanol. And that ethanol will extract the CBD, other cannabinoids, as well as the terpenes, and then it goes into what's called a rotovap. And a rotovap is a slowly circulating vessel. It's over very, very low heat, and that heat slowly evaporates off the ethanol, which then condenses onto the coils, and what's left at the end is just the oils. The difference between a marijuana plant and a hemp plant is the level of THC found in that plant. An industrial hemp plant is identified as a plant that produces less than 0.3% THC. A normal marijuana plant has about 15 to 20% THC in it, and sometimes these days you're seeing them up as high as 25 to 30%. So THC is the cannabinoid found in the cannabis plant responsible for giving you that high effect. As humans, we use cannabis recreationally, but it can also be used medicinally. Because our plants are at less than 0.3%, you won't necessarily get that high feeling. However, the THC that's in there is extremely important for what's known as the entourage effect.
The plant itself has about 500 compounds in it, a couple hundred cannabinoids, and there's also a couple hundred terpenes. It takes all of those, the whole goodness of the plant, to have a maximal benefit.
Terpenes are the smells that we get from plants. Lavender, for example, the terpene that's responsible for the smell of lavender is called linalool, and linalool is found in cannabis. So is something called myrcene, which is found in mangoes, also found in cannabis. So you're looking for terpenes to give you a full spectrum oil, as well as cannabinoids. And the most important, I think, for a full spectrum oil is the THC that's in there. So CBD, just like THC, comes from the flowers, the buds of the plant. And CBD is mainly used for the following 4 things: anxiety, sleep, pain, and inflammation. CBG, just like CBD, can be found right in the plant. We actually have varieties of hemp that are CBG dominant. From our experience with CBG, it gives energy, mental clarity. CBN is different than CBD and CBG because there isn't a CBN dominant plant. CBN is actually degraded THC. THC oxidizes and converts into CBN. And so if you've ever smoked old weed and you felt tired after, it's probably because the THC has converted into CBN, and CBN has sedating effects, so it makes you more sleepy.
Nothing's 100%. There's no chance of overdose using cannabinoids. The part of the brain that controls respiration can be impeded by opioids and cause overdose and death. There's no cannabinoid receptors in that part of the brain. There's opioid receptors in that part of the brain. The cannabinoids work for everyone. I would say the response rate is between 80 and 90% when I certify patients. It's not a lifetime certification. In New York, it's a year at a time, and I'd say 80% of patients recertify. The response is pretty overwhelmingly positive.
If you're thinking about trying out cannabinoid therapies, the first thing I would recommend is reaching out to your doctor, because there are different interactions with different medications that you should be aware of, and hopefully your doctor can help you through that. Everyone's systems respond differently to cannabinoids in general. What we recommend is starting low and slow. It takes about a week to start noticing any kind of difference, and we generally recommend taking CBD every single day for a month before making a judgment as to whether or not it works for you. It's not an instant remedy. You're not gonna all of a sudden feel like on top of the world after a day of taking it. It takes commitment and it takes routine, and it's something that you have to make sure fits into your life.
Medical cannabis comes in many formats of vapes. However, patients must consult their medical marijuana physician of which format is safest. Other formats include tincture oils or sprays for under the tongue. Edibles of medical cannabis can be made into baked goods or drinks. There are pill forms and topical ointment formats of medical cannabis as well. Medical cannabis is not covered by insurance in the state of Florida. There are still state regulations where a license for medical marijuana is required to use this as therapy for qualifiable conditions. Only licensed medical marijuana physicians can certify patients and guide patients. Some suggestions where medical cannabis should not be used for those under age 21, over age 65, pregnant patients, breastfeeding, patients who have cardiovascular or pulmonary disease, history of a substance use disorder, long-term opioid or benzodiazepine use, or history of psychosis. Always consult with a doctor before using medical cannabis. For patients with fibromyalgia who cannot qualify for medical cannabis or cannot afford it, other alternative therapy options may help manage symptoms other than prescription drugs. Patients can consider aquatherapy, cognitive behavioral therapy, acupuncture, and practicing yoga, tai chi, or Pilates. Certain lifestyle modifications, such as avoiding nicotine smoke, incorporating an anti-inflammatory diet, and stress reduction through meditation are all important aspects to help manage fibromyalgia.
Emma is sitting deep in thought. She's been living with fibromyalgia. Emma prefers a natural approach. She's cooking a healthy meal. Exercise is another form of her treatment. She's practicing yoga. She believes in the power of aromatherapy. She's meditating, diffuser softly humming. Knowledge is her weapon. She's reading a book on fibromyalgia. Her journey is challenging, but Emma is hopeful and persevering.
Now that you have learned a little bit more about fibromyalgia and the potential benefits of medical cannabis and/or other alternative therapy, talk to your provider about getting a referral for medical cannabis evaluation with a licensed medical marijuana physician, or inquire for a referral to other alternative therapies.